Welcome to the Lynn Community Television Show. I'm Sean Donahue, here with me today from ISD Public Health to talk about the Prevention and Wellness Trust Fund. We have Karin Carroll, the Program Director, and we're going to talk to her a little bit more in detail about what she does. But we're here today to talk about this grant, and it's an outstanding grant. It's been in existence since 2012, and we're going to talk about why it was, who did it, who's involved. But first and foremost, I'd like to make our viewership aware as to who our guest is. Karin Carroll, the Program Director over there at ISD Public Health. Tell us what you do over there.
Hi, Sean. Thanks for having me today. I'm the Program Director for the grant, and it's held, the host agent for the grant, or the coordinating partner, is the City of Lynn. They were awarded the grant 3 years ago now. And it's a $5.7 million grant that came to Lynn. We have 5 partners that work with us, and we'll talk about those a little bit later. I think each of our partners here in Lynn. But my role is to kind of oversee the partnership for the grant and make sure that the teams are working well together, meeting the deliverables of the grant and the state. We have large budgets, obviously, that we need to manage and allocate. I'm responsible for overseeing those budgets, for the training needs that might come up for the teams and staff involved in the grant, and to kind of continually be working with the teams that are involved in this program to see how we can do things better. It's been a real learning experience for us, for better or for worse. We've had some good times and we've learned a lot as we've gone. So my role as the Program Director is to kind of keep the teams moving along and coming together, problem solving, and getting the grant set up and then tweaking it as we go to improve things.
So you, as the Program Director, are to ISD Public Health and the Prevention and Wellness Trust Fund like a manager would be to a baseball team. You're going to make sure that all these guys are showing up to practice, they know what they're doing, they know what the game plan is. All right, cool.
Yeah, you wouldn't want me in charge of your baseball team, but yeah, I can. Yeah, that's a good analogy.
All right, so I want to talk a little bit about just the grant overall. Can you describe it? What's its mission? How does it work? What's its overall function?
Sure. The PWTF is the short name for it, Prevention Wellness Trust Fund, was set up in 2012 from the state legislature. And it was part of Chapter 224. It was put in place to set aside money and funds for evidence-based healthcare programs. And the idea was to look to the research around chronic diseases that we know are preventable and say, how can we do a better job at improving the health of people with these diseases, as well as lowering costs associated with these things? Because in theory, if they're preventable, so should the costs that are contributing to our skyrocketing healthcare costs. Mm-hmm. So the state set about looking at the research and looking at the evidence and saying, well, what do we know through time has worked to achieve these 2 outcomes of lowering costs and improving health outcomes for patients? And there are a number of different interventions, but we chose to work on 4 different chronic diseases here in Lynn. And we chose those diseases mainly because the rates are higher in Lynn than for other communities throughout the state, or higher than the state average. For smoking rates, children with asthma, seniors who have fallen or are at risk of falling, and hypertensive patients. So all those chronic diseases that are highly preventable are higher. We have very high rates in Lynn, or higher than the state average. And so we really wanted to see if we could make some headway by choosing those 4 chronic diseases to work on. And the main part of this grant is linking the patients to services out in the community, because we know that folks go to the doctor maybe once a year, maybe twice if they've got other issues going on, and they maybe have that 1 or 2 encounter with their clinical provider a year, whereas they live and they go to school and they work and they play out in the community, and that's where we can really make big gains with their health. So that's the idea of the grant. That's the premise.
All right. So now this grant, Lynn is one of 9 grant recipients.
That's correct. There were 9 awardees throughout the state. They range from Holyoke to down on the South Shore, Quincy, Metro West, and Boston, and yeah. So the North Shore area, Lynn is the only grant holder for the North Shore area.
So now our main focus is pediatric asthma, hypertension, high risk adults who are at risk for falling from injuries, and then tobacco use. These other communities, are they focusing on similar subjects, or is there anything different that maybe they're focusing on?
Good question. The two other areas that you could have chosen were substance abuse and diabetes. Those were the other two chronic diseases that were on the menu of choices for PWTF grantees to choose from. Lynn did not, and I wasn't actually employed at the time. I don't know their process, but we chose 4, which is the maximum. No other, I think one other grantee chose 4 of the 6 to do. So Lynn, really took on a lot, but they've been able to do a lot and achieve a lot.
Yeah, this has been a great benefit to the community. We'll talk about that a little bit more in detail, but I'd like to talk about just the specs of the grant. I think you've mentioned before, but we can reiterate. How many millions of dollars did Lynn receive? And overall, how has that money been put to work? All that fun stuff. This is an opportunity for you to explain all that to me.
Great. So the PWTF was about $60 million set aside from the state legislature for the 4 years.
2012.
In 2012, it was earmarked for these programs. Lynn received almost $6 million over the 4 years. So we have a budget of $1.7 million per year for this grant. The budget is divided out amongst the 5 partners. We actually hold the budget and manage it here in-house in City Hall. So we rely on the infrastructure of the city, which is great and a tremendous support to us. You need that infrastructure in order to be able to manage a grant of this size. It's a lot of money to be managing and ensuring that things are organized and in place. So our partners invoice us as they provide services out in the community, as they run classes or see clients or offer programs, but they largely manage their own budget within the PWTF. And each year there is a process of where the grant executive meet and set budgets and renegotiate budgets for the coming year. We've had a steady budget all for 3.5 years from the state. So that's made it nice that there weren't reductions as time went on. So the 5.7 comes to the City of Lynn and to all of the partner agencies to provide direct services to these clients that meet the criteria of high risk for one of these chronic diseases.
All right. Yep. So you guys have to work to the city infrastructure, and that's kind of like the umbrella organization. Underneath, you have some cooperating partners, community organizations as they're listed, the clinic, Lynn Community Health, and then you've got community organizations like GLIS, Lynn Housing Authority, the Lynn Public Schools, MAPC, and then we've also got the Massachusetts Coalition for the Homeless. So how do these guys fill in? What's their role?
Sure. Okay, so now I'll get into the breakout of the grant. So we're the coordinating partner, as Sean explained. The idea is that all of our participants start as Lynn Community Health Center patients. Most of them, I should say, are going to be Lynn Community largely. And the idea of the grant is that we wanted to test and see if we could link up a patient at the health center with programs in the community that might be more accessible, more regular, and provide them with more opportunities to improve their own health. So for example, a physician might see a senior coming in for an appointment. There are staff at the health center that would start looking at the appointment roster for next week, and they might pre-screen that person. They might put a phone call in and say, you're in the age category where you may be at risk for falls. We'd like to ask you a few questions. They'll flag the information they learn to the providers when the person actually comes in for their appointment the following week. The physicians, the clinicians, the nurses, whatnot at the health center, when they meet the patient, they'll further assess whether this patient is at risk for falls. They'll ask them a series of questions, and they'll run the CDC steady screening tools, and they'll use those tools that they've all been trained on as a result of our grant. All the clinicians are trained, and they'll screen them and assess again whether they're eligible for certain home and community programs. At that point, the staff, and we have what we call an embedded social worker. This is another really nice part of this model here in Lynn that will be replicated and has been replicated in other parts excuse me, of the state, where there's a social worker who works for GLIS, Greater Lynn Senior Services, and they are physically located within the health center. So they help manage those connections and make that a really fluid process for the providers and the patient. So once we identify the person's at risk, we refer them over to a program at GLIS, or for the other chronic diseases, it might be a referral to the Mass Coalition for the Homeless for a home visit. It might be a referral to a school program. And then GLIS picks it up from there, and they'll invite them into one of their Tai Chi classes if it's a balance issue or matter of balance, or they'll provide a home visit where they assess the home environment for tripping hazards.
Wow.
And that brings us to our next partner, which is Lynn Housing Authority and Neighborhood Development Authority, and they will come in and offer home modifications if they're determined to be necessary for the safety of the patient.
Right.
So once the home visit and the inspection has been conducted, the housing authority can come in and offer some modifications to that environment to make it safer, like grab rails or other accommodations within the home.
So you've got legitimate organizations to attach to these jobs that need to be done. These collaborators are super important to what you guys do.
Yeah.
I mean, these guys are able to justify the need. Yeah, we're Lynn Housing Authority. We work with senior citizen housing all the time. We got a referral from the health clinic. This person may be a high-risk adult who could fall and hurt themselves. We went to the house, and it's definitely something that we need. Luckily, we've got this grant. We can help this gentleman or mat him out. That's outstanding.
Right.
And the collaborations, like the network, how it works, the referrals and all that stuff really speaks to the effectiveness of it, which is our next talking point right now.
Okay.
So over the past 4 years, this grant has done its job significantly. Outside of providing health benefits to the community, we've also provided job creation to the community. We've created awareness about these certain areas of health and focus for preventative care. The effectiveness of this program, it's been in existence for 4 years and it's done its job. Tell us a little bit more about that.
Yeah, so speaking of jobs, one of the interesting components of the grant is the use of what are known as CHWs, which are community health workers. Now these workers have been here in Lynn. We did have a few prior to the grant, but now we have a few more, and it's largely a model that the PWTF at the state has really helped us develop and train these CHWs in asthma, falls, hypertension, to support patients in their homes. So we're now utilizing these CHWs, these positions. These are people who are members of the community, they know the community that they work in, and they link up patients with resources that they need. So that's been a tremendous benefit to our patients, that these CHWs can go into the home, provide education on asthma, they can assess home environments, they can do a whole range of things, which is really great in providing services to people in their homes.
And now, is this something that they would have been able to do without the grant?
Well, as I said, there were a few positions in existence, some at the Mass Coalition for the Homeless, some at Lynn Community Health Center, but we've expanded those roles and we've expanded those numbers of CHWs and other providers as well. So the grant has allowed all of our partner organizations to bring on a number of additional EFT or staff to help run these interventions, teach these classes, provide the services to patients that we need.
The industry that these collaborators work in, I think, would be classified as human service. It's such an interesting industry, it really is, and it's so important. I mean, it ranges from fire department to the police department to local community health centers like Lynn Community Health. And it really is, it's like this selfless act. I mean, and it's over and over and over again. It's high volumes of people who need help. They need to be approached with tons of empathy. It's a tough gig. It really is. And it really, I mean, to to talk about these organizations that are involved, the collaborators. You've got LHAND, you've got Lynn Community Health Center. I know I'm forgetting a bunch of them. Lynn Public Schools. Right. Those guys. Yes. I mean, everybody's on board to do this. Yeah. And it really just human services are like, it's an industry that's there to afford a better quality of life, per se. Is that what we're trying to achieve here? And now there's a buzz in the city of Lynn about the Lynn Quality Initiative and bettering our quality of life. How do you think that this translates for the city of Lynn when it comes to better quality of life? Yeah, absolutely. I mean, I think this is all about what this grant is really about, looking at what we call in public health the social determinants. So we know that a very small percentage of what truly impacts our health happens in the clinical realm. Maybe 10 or 20% is the best estimate. The other, 70, 80% of our health is determined by our genetics and by what happens in our environment. So we know that that is huge, and this grant is really an attempt at funding those programs that often don't get funded by the classic sort of traditional payers in healthcare, which is insurance companies. Right. So part of what the state and the programs like ours will do in the coming year or two is look to ways to sustain this work by working with providers and payers of healthcare to see if we can find ways to restructure within our payment system to include some of these programs that really have a huge benefit and link our clinical patients to the community. And that's where we're seeing just tremendous gains. And I can give you an example. I can give you lots of examples, but I know we don't have all day. But over at GLIS, there's a kiosk set up where patients can self-monitor their own blood pressure. It's staffed by nurses. We have Spanish-speaking nurses as well. We can translate. We can provide a range of services and referrals for folks. And in the past, that kind of sat over there in GLIS, and if a patient that came in that they were really concerned about, they sometimes didn't have a mechanism to communicate that back or get more information from their provider. And through our program and our teams working together monthly, getting to know each other, developing protocols, they now have a system where a nurse at the kiosk can get a hold of the cardiac nurse or someone at Lynn Community Health Center to assist them immediately with a patient of concern. And that might be to bring the patient right back over, it might be to make a follow-up appointment, there might need to be a meds adjustment, and all those things can be discussed by these two providers that are physically seeing the patient, working with the patient, and providing the best care immediately for that patient. So we see a lot of exciting things around the partnership, and that's much of the benefit of this experiment, and it really has been an experiment in public health, this grant, is to find out how these partnerships can work together better and how we can streamline that. So, another component of the grant was the rolling out of a software that the state developed called ERG, or e-referral. And it's an electronic referral system. I believe it's the first in the nation. And it's very interesting in that it allows the clinical site to make a referral of a client out to the community. So for the first time ever, we're seeing some databases link up. And the idea is that down the track, the state or evaluators who are looking at this program will be able to pull data from these systems and really see, well, how did Mr. Jones do, when he went from here to here, and then we find out that he completed a class or he attended a program, and then we can really track the progress over time. So it's exciting to see this kind of thing happen in healthcare. Yeah, and it seems as though it's working. I mean, especially today, you hear about affordable healthcare and what insurances will and won't pay for. Yeah. We might be on to something right now and being able to actually reach out to the government, get some grants for this, and be able to afford better public health. Yes. We've got about 2 minutes left in the program. Yeah. 2012 is when the grant was put into place. The grant was to last 4 years. Lynn was one of 9 communities that received this grant. Yep. It was a $60 million grant. We received just under $6 million. To Lynn, yep. So what's the plan for the future? Yeah, well, we've had over 1,000 referrals here in Lynn from our health center out to our community sites and programs. We offer 9 different programs within the community for these different conditions.
We've been able to implement smoke-free housing policy, so some of our grant does policy work as well that impacts a large number of people at once by making those units all smoke-free, protecting people from the risks of smoke-free housing. So we hope to continue that. You know, we have another year and a bit left on the grant where the programs will keep running, and we'll try to, you know, offer the programs to as many high-risk patients in Lynn as we can during that time. And then we hope that there will be ways to sustain, and our teams are looking at that now. Additional funding sources perhaps, renewing of some funding from the legislatures, or maybe just looking at ways we can incorporate the work and have it be sustainable within the city on an ongoing basis. So there's all kinds of ways, or using technology to continue to sustain some things. Another big part of sustaining is training. So in the schools, we've trained up nurse champions, and we hope to continue that over the next year to get as many of our staff here in Lynn trained to run and offer these programs, and that will go on for many years to come once you have people who are trained. So there's a number of ways that we hope to continue this good work, and we're very excited about the accomplishments that Lynn has been able to achieve in a short time.
It's going to be worth your time at home to follow up on this story and make sure that, you know, these guys actually are able to actually continue to do the great work that they've been doing. I got to say, if you're just joining us, you got to reach out. The Special Services Department, Public Health, you can reach out to these guys. Right here in City Hall, room 105. You can also find them on Facebook/Lynn ISD Public Health, on Twitter, ISD Public Health. I want to say thank you to my guest, Karin Carroll, the director of the Prevention and Wellness Trust Fund, a grant established in cooperation with ISD and throughout the whole entire city of Lynn. We're going to hear more about this in the future. But I want to say thank you to our guests for tuning in. That's it for the Lynn Community Television Show. I'm Sean Donahue, wishing you all the best. So that's pretty much the story.
Yeah, good.
Our mics have been killed. Looks like we're